Do you know the common symptoms of these diseases? That's the question we're going to explore today. We're about to embark on an enlightening journey, shedding light on various health conditions that affect millions of people across the globe. We'll be discussing a wide array of conditions, from the common flu that hits us every winter, to the prevalent diabetes, the misunderstood ADHD, and the highly infectious norovirus. We'll also be talking about the life-threatening cardiac arrest, the degenerative frontotemporal dementia, the autoimmune Hashimoto's disease, the global pandemic instigator COVID-19, the respiratory syncytial virus or RSV, and the all-too-common urinary tract infections. Each of these conditions has unique signs and symptoms that can help us identify them early and seek the necessary medical intervention. Knowledge is power, and understanding these symptoms could potentially save lives. So stay tuned as we delve into the symptoms of each disease. First up, we have the flu, a common illness that can cause serious complications. You might be familiar with its typical symptoms, which can appear 1 to 4 days after the virus enters your body. Fever is usually the first sign, often accompanied by chills. You might feel as if you've run a marathon without leaving your bed, thanks to the muscle aches that the flu brings. Coughing is another telltale symptom, which can be dry or with phlegm. You might also experience congestion and a runny nose, as the flu is a respiratory illness. Headaches are another common symptom, making it hard for you to focus on anything else. And let's not forget about fatigue. You might feel overly tired even after a full night's sleep. These symptoms can be quite uncomfortable, but they're your body's way of fighting off the virus. Remember, the flu can be prevented with a yearly vaccine. Next, we explore diabetes, a chronic disease that affects millions of people worldwide. This condition is characterized by the body's inability to properly process sugar, leading to elevated levels of glucose in the blood. But what does this mean in terms of symptoms? Well, one of the most common symptoms is frequent urination. Individuals with diabetes often find themselves making numerous trips to the bathroom. Another symptom is increased thirst. Despite drinking ample amounts of water, they may still feel parched. Constant hunger is another telltale sign. Because the body cannot efficiently use the glucose from food, it demands more fuel, leading to persistent hunger. Unexplained weight loss can also occur as the body starts to use fat and muscle for energy. Tiredness and blurred vision are other symptoms that can hint at diabetes. Fatigue results from the body's inadequate use of glucose, and high blood sugar levels can cause fluid to shift in the eyes, affecting vision. Early detection of diabetes can help manage the disease effectively. Moving on to ADHD, a neurodevelopmental disorder that often starts in childhood. Attention deficit hyperactivity disorder, better known as ADHD, is characterized by a group of behavioral symptoms. The most common among them is difficulty paying attention. Individuals with ADHD may often find themselves easily distracted, having a hard time focusing on one task, or frequently forgetting details of daily routines. Another symptom is hyperactivity. If you think about the typical image of a child who can't sit still, is always on the go, or seems to be driven by a motor, that's a close depiction of hyperactivity. It's not just about physical movement, but also about the mind racing with thoughts. Impulsive behavior is another hallmark of ADHD. This could manifest as impatience, difficulty waiting for their turn, or often interrupting others in conversation. It's important to remember that these symptoms can vary greatly from person to person. ADHD can be managed with the right treatment and support. Now let's discuss norovirus, a very contagious virus that causes vomiting and diarrhea. It's an unpleasant topic, but understanding it can help you know what to expect if you or a loved one becomes infected. One of the most common symptoms of norovirus is diarrhea. This can be severe and persistent, leading to dehydration if not properly managed. Vomiting is another common symptom, often occurring suddenly and without warning. This too can contribute to dehydration, particularly in young children and the elderly. Nausea is another symptom that many people with norovirus experience. This can be a constant feeling, or it may come in waves, often accompanied by a general feeling of malaise. Stomach pain or cramps are also common, and these can range from mild to severe. Norovirus is highly contagious, so it's important to practice good hygiene if you or someone in your household is infected. This includes thorough hand washing, avoiding sharing food or drink, and cleaning contaminated surfaces. Hygiene practices can help prevent the spread of norovirus. We now look into a set of diverse diseases, each with unique symptoms. Let's start with cardiac arrest. This is a serious condition that requires immediate medical attention. It happens when the heart suddenly stops beating, cutting off blood flow to the brain and other vital organs. Symptoms are often sudden and severe. They include sudden loss of responsiveness, no normal breathing, and no pulse. If you witness someone experiencing these symptoms, it's crucial to call for emergency medical help immediately and start chest compressions. Next, we have frontotemporal dementia, a group of disorders characterized by the progressive degeneration of the frontal and temporal lobes of the brain. These areas are associated with personality, behavior, and language. Symptoms may vary based on the specific area of the brain affected. Some common signs include drastic personality changes, language problems, and behavioral changes that are often inappropriate or bizarre. Unlike other forms of dementia, memory usually remains relatively preserved until the later stages of the disease. We then move on to Hashimoto's disease, an autoimmune disorder that affects the thyroid, a small gland at the base of the neck. This condition can cause a variety of symptoms, which may develop slowly and be subtle, or occur suddenly and be severe. The most common symptoms include fatigue, weight gain, sensitivity to cold, joint and muscle pain, constipation, and dry skin. Women are more likely to develop Hashimoto's disease, and it often runs in families. COVID-19, a disease caused by the novel coronavirus, swept across the globe in late 2019 and continues to affect millions. Symptoms range from mild to severe and can appear 2 to 14 days after exposure to the virus. The most common symptoms include fever, cough, and loss of taste or smell. Other symptoms can include shortness of breath, fatigue, body aches, sore throat, and in severe cases, difficulty breathing. Respiratory syncytial virus, or RSV, is a common respiratory virus that usually causes mild, cold-like symptoms. Most people recover in a week or two, but RSV can be severe, especially for infants and older adults. Symptoms include runny nose, decrease in appetite, coughing, sneezing, fever, and wheezing. In severe cases, it can lead to serious lung infections and hospitalization. Lastly, we'll talk about urinary tract infections, or UTIs, which are infections in any part of the urinary system: kidneys, bladder, ureters, and urethra. Most UTIs are caused by bacteria, but they can also be caused by viruses and fungi. Symptoms include a strong, persistent urge to urinate, a burning sensation during urination, passing frequent small amounts of urine, and urine that appears cloudy. Recognizing these symptoms early can lead to prompt treatment. It's important to remember that many of these symptoms can be signs of other conditions as well. If you or a loved one are experiencing any of these symptoms, it's essential to consult a healthcare professional for a proper diagnosis and treatment. To wrap up, let's summarize what we've learned. We started with flu symptoms, which include fever, cough, sore throat, and general fatigue. Then, we moved on to diabetes symptoms such as frequent urination, increased thirst, and unexplained weight loss. ADHD symptoms include hyperactivity, impulsivity, and difficulty focusing. Norovirus symptoms are characterized by stomach pain, nausea, and diarrhea. We also explored a variety of other health conditions. Cardiac arrest presents sudden loss of responsiveness and absence of normal breathing, while frontotemporal dementia may cause changes in personality and language difficulties. Hashimoto's disease often leads to fatigue and weight gain. COVID-19, on the other hand, manifests with fever, cough, and shortness of breath. RSV primarily causes respiratory issues, especially in young children and elderly adults. Lastly, urinary tract infections typically result in a burning sensation during urination and increased frequency of urination. Remember, knowledge about these symptoms can help in early detection and effective management of these diseases.